So here at Cancer Care Manitoba, I was fortunate enough to receive, again, national research funding from the Canadian Institutes of Health Research to study those factors that facilitate or hinder the uptake, the use of consultation recording into practice. So we interviewed the docs, the nurses, the CEO, and we sort of said, well, what would it take to move consultation recording into practice? So we identified any barriers, addressed those barriers, and launched on a small scale a consultation recording service at Cancer Care Manitoba. After 6 months, an internal review was held, as they do with any new service, and they made some sort of changes in just the procedures that they're going to follow. And then in the September, they'll be relaunching the service again to patients coming through, probably in 3 or 4 disease sites, and then expanding. So starting with the disease sites we've already used, and then expanding with the goal then that every newly diagnosed cancer patient in the province will be offered a recording of their initial treatment consultation if they would like to have one. And we're encouraging the recording of pivotal consultations, which include the initial consultation, but also 2 other pivotal consultations. One where you've had cancer, you think you might be doing okay, but then you have a recurrence. So you're coming in, again, new treatments planned for you. Also a switch from regular follow-up care or treatment to palliative care, when we know that the treatment will no longer be for cure because that's not possible. So we're switching to a palliative care treatment. That can be a very important consultation for patients to have as well. So we encourage the offering of recordings for any of those pivotal consultations. So that will be starting back up in September, which I'm quite excited about. Very, very excited about, because it makes Cancer Care Manitoba the first cancer center in the world to routinely have a consultation recording service.